with them for 3 months now. As of this week, formerly worked for the DOT in Montana. So bloodborne pathogens, there's a lot of content here, but it's all very important. So we'll go ahead and get started. In this session, we're going to cover OSHA's bloodborne pathogen standard, the definitions of bloodborne pathogens, the most common pathogens and their causes and symptoms, hepatitis B program, the development of an exposure control plan, as well as we'll close out with some hands-on demonstration of how to properly take off gloves and to clean up a blood spill. So in December of 1991, OSHA introduced the Occupational Exposure to Bloodborne Pathogen Program. This standard is designed to eliminate or minimize exposure to pathogens in the workplace and covers anyone that might be exposed to blood or OPIM. OPIM is short for other potentially infected material. Bloodborne pathogens are microorganisms that travel through the bloodstream. When we talk about bloodborne pathogens, we normally think about blood, but these pathogens can also be found in OPIM. They may include fluids such as saliva, mucus, urine, or semen. While there are many diseases that may be transmitted through bodily fluids, the most common are HIV, hepatitis B, and hepatitis C. In this presentation, we'll look at each in detail. While we normally think of healthcare workers as the main occupation covered by this standard, there are many other occupations such as housekeepers, teachers, custodians, office staff, police, firefighters, and bus drivers. Also are covered are potentially exposed are corrections and law officers, lifeguards, massage therapists, and those involved with elderly and disabled or children. So there are 4 stages in the infection process. These basically starts with a person that's been infected. Then next stage is that the pathogen has to leave the carrier's body. That may occur through a cut, or the person may cough or sneeze out droplets, causing pathogen to transfer. Next stage is pathogen has to reach or enter the vehicle, the victim's body. This can come through direct contact, either through a cut or mucus transfer, or it may occur through an indirect method. So, for example, inhaling droplets. Oops. Sorry about that. Through, let's see, inhalation or so it may be caused through cough or sneeze droplets, causing the pathogen to transfer. Another stage is the pathogen has to reach or enter the victim's body. This can be caused through direct contact, entering the body through a cut or mucous membrane, and so forth. That may occur through mosquito bite or tick bite. Finally, the victim develops an infection, but this is far from automatic. If the person's been vaccinated against the disease or has a healthy immune system, this disease may never develop. In fact, there's never been a recorded case of someone contacting the disease without giving first aid. Next, we'll look at some common diseases and causes and symptoms. So HRV, human immunodeficiency virus, attacks the immune system, eventually causing AIDS. Even though a person is infected, it may take years before symptoms show and the disease begins to surface. The virus, this virus is very weak and dies almost immediately once exposed to air. So within 20 seconds, it's weak enough where it probably wouldn't transmit a disease, and within 45 seconds to a minute, it's dead. In the U.S., most common ways HIV is transmitted are through unprotected sex and through sharing needles. Blood transfusions are another way it's passed, which is fairly uncommon in the U.S. However, in developing countries it is. In Africa, for example, it's the most common way. Actually, in Africa, the most common way is transmitted through mother to baby. HIV is not contracted through casual contact, so you'll not contact HIV through shaking hands, through giving someone a hug, or sharing your phone or a bathroom. In the first weeks after exposure to HIV, there may be no symptoms at all, even though the victim is still infectious. Or there may be common flu-like symptoms such as fever, headache, or sore throat or rash. Final symptoms of HIV may not show up until years later, and the first sign that usually brings a person to the doctor is swollen lymph nodes. At this point, the victim may begin to experience diarrhea, weight loss, fever, cough, shortness of breath, and finally death. Currently, there's no cure for AIDS. Once you have the infection, your body can't get rid of it. However, there are many medications that can control HIV and prevent complications. Hepatitis C, or HCV, is transmitted only through blood and attacks the liver, but it may not always cause serious health problems. Many people who carry HCV do not feel sick. When they do, it's usually flu-like symptoms, but once it affects the liver, it could develop jaundice, cirrhosis of the liver, resulting in liver failure. In the US, the CDC estimates that 12,000 people die each year from HCV-related illnesses. Researchers have made significant advancements in the treatment for hepatitis C using new direct-acting antiviral medications, sometimes in combination with existing ones. As a result, people experience better outcomes, fewer side effects, and shorter treatments. The only reliable test for HCV is the blood test. There are some issues with this test, so false positives are common, and should you receive a positive result, you'll want to arrange to have a follow-up test. False negatives can also occur if the test is taken too early and the antibodies in the body have not yet developed. In these cases, a different type of test might be recommended by your doctor. While hepatitis C can potentially be transmitted in the work environment, it's most commonly transmitted through sharing needles, using unclean tattoo or body piercing tools, or sharing items contaminated with blood. It can also spread from a pregnant worker to her baby, and occasionally through sexual contact. Hepatitis B virus, or HBV, while it's still rare, it's the most common occupational bloodborne disease. Each year, approximately 250,000 people are infected with this pathogen. This disease also attacks the liver. Jaundice, or the yellowing of the skin and eyes, is the most common symptom. Once the disease attacks the liver, there's a 400% greater chance of liver cancer. In fact, it's the leading cause of liver cancer and the most common reason for liver transplants. While HBV can be transmitted through bodily fluid, the most common are in semen and blood, but it also can be transmitted through such activities such as body piercing, tattoos, mothers to newborns, and organ transplants. HBV is not transmitted through food and water, fecal matter, air, casual contact, or casual contact with an infected person. The early symptoms of HBV are flu-like. Victims usually don't seek medical treatment until jaundice appears. Jaundice coupled with pain in the upper right side of the abdomen are signs that the liver has been affected. Symptoms usually appear 45 to 60 days, with the average being 120 days. During this time, the victim is infectious and is able to pass on the disease to others. There are two potential outcomes if you've been infected with HPV. If you have a strong immune system, which is the case for 95% of adults that are infected, their immune system is strong enough to attack the virus and will ultimately kill that virus. In this case, the victim will recover, but liver damage is likely. Good news is that this person, when this person does recover, they'll be have lifelong immunity to the disease. But if the victim has a weak immune system, there'll be fewer symptoms and also liver damage. However, that victim will not develop the antibodies and will carry this virus for decades. If that person still has the virus after 6 months after being infected, he or she will be considered chronically infected. OSHA requires that an exposure control plan be developed whenever workers may be exposed to blood or OPIM on the job. As part of this plan, OSHA requires employers to first identify the job positions that may have been exposed to the virus. This might include drivers, custodial, or office staff. Tasks that might be identified as a source of potential exposure are providing first aid, cleaning up after sick passengers or staff, and cleaning bathrooms. As required by OSHA, employees must be trained when first hired and then annually through safety meetings, online programs, or as part of a CPR, AED, or first aid class. Companies must also initiate a hepatitis B vaccination program and have thorough post-exposure evaluation and follow-up program in place. Should there be an exposure to a bloodborne pathogen, extensive record keeping will occur. In addition, agencies must develop bloodborne pathogen procedures which outline the engineering and work practice controls that have been implemented. Also identified must be the required personal protective equipment, or PPE, that should be worn when providing first aid or cleaning potentially infected materials. As part of this program, bloodborne pathogen kits must be provided and used when an incident has occurred. These might include such things as disinfectant spray to discontaminate surfaces and equipment such as gloves, masks, and a gown to protect your clothing. Finally, the incident forms must be developed in order to evaluate each potential exposure incident to assure that procedures will follow and strengthen the plan if needed. Normally, there are 3 forms that will need to be developed. One form is completed by the injured person, one form to be completed by the infected person, and one form to be completed by the supervisor. As part of the exposure control plan, engineering controls are the preferred means of controlling exposure as they minimize the potential. Engineering controls include sharps and utility blade containers, hand washing facilities, and warning labels that are found on chemical containers or bags. So, administrative controls found in the exposure control plan include policies and procedures developed to protect employees, but also include the on-the-job or OJT training that you'll receive at the end of this presentation. You'll see what PPE is required by your agency and how to wear it and maintain it, where the first aid bloodborne pathogen kits are kept, how to use the eye wash station if one is available, and how to decontaminate the area after an infection. As part of the exposure control plan, the employer must also outline the agency's hepatitis B vaccination policy. OSHA requires that if an employee has potentially been exposed to hepatitis B, the employee is required to offer HBV vaccination at no cost to the employee. at a convenient time and place during normal work hours, and pay travel costs if travel away from the work site is required. The good news is that there's a vaccination to prevent HBV. It consists of 3 vaccinations. There's an initial shot followed by a second one a month after the first. And a third shot is given approximately 6 months after the second. The vaccination is prepared from yeast culture, not blood or plasma, so there's no risk of contamination. Most common adverse reaction is soreness at the injection site. This is if you've been exposed to HBV in the past and have already had hepatitis B vaccinations. Your doctor may suggest that you get a booster, but many times this isn't necessary. Employees are not required to have immunizations, but if you decide not to, you will be required to sign a declination form. If you change your mind at a later time, notify your supervisor. The declination form will be destroyed and arrangements will be made to get the vaccination. You may have already received this vaccination before, even maybe if you, prior to entering elementary school. In fact, in many states, it is required before enrolling in school. Or you may have also received this vaccination if you've served in the military or if you've worked in the healthcare field. If you've already had the vaccination or think you have, it's important for you to talk to your doctor before you start another series. OSHA states that the hand washing location should not be near food or food processing. So never wash your hands in a break room, sink after an incident. The best place to wash your hands is in a restroom. Even though antibacterial soap is recommended, any soap can be used. And remember to be gentle on any scabs or sores that may be present. And if you have an open sore, cover that with a Band-Aid. After washing your hands, make sure that you wash all surfaces of your hands, including between the fingers, under the nails, and over the back of the hands and wrists. If soap and water aren't immediately available, use an antiseptic towelette or washing liquid, and then wash with soap and water as soon as you can. When possible, hands should be washed before starting first aid, but if it's not possible, use an antiseptic wash or antiseptic wipes before donning your gloves. Then after that, you'll want to wash your hands as soon as possible after removing your gloves, especially if you've had contact with blood or other potentially infectious fluids. Most important thing to remember is to follow universal precautions when doing any task where there's possibility of exposure. Treat all blood and other bodily fluids as though they could be contaminated. So in layman's terms, if it's wet and it's not yours, don't touch it. There's a wide variety of PPE that's been developed especially for bloodborne pathogens. When you go through the on-the-job training, your supervisor will show you where they're kept and how to use and maintain them. This is especially important. It's especially important to check your first aid kit on your buses or vans to ensure that you have the proper first aid materials needed and that they're still on the bus or van. It's also important to encourage the injured person to provide their own care in the case of a less serious injury so that you're not exposed. A good example of this would be if one of your riders or clients has like a cut, then best for them to apply their own Band-Aid. The red hazard bag would only be used in extreme situations, and it would be rare if you ever had to use one. It providing first aid for minor injuries, a small cut, for example, gloves and materials is all that you would need to use. Wearing PPE properly is the best defense against unexpected hazards, and it helps to minimize the risk of occupational exposure. To be effective, the equipment must be clean and in good repair, and it must be cleaned and disinfected after each incident. The red hazardous materials bags are only to be used to clean saturated materials as you're using it to clean up after an incident. This means that there's so much blood that red drips. If you have any questions on whether the red hazard bag should be used, please contact your supervisor. It's also important to remember that there are limitations of PPE, especially the gloves. Prior to donning your gloves, you'll want to blow into the glove to make sure it doesn't have any leaks. Even a small hole could expose you to the pathogen. If you wear rings, or you're working in an area where you might tear the gloves, you'll want to put on 2 pairs of gloves. This will provide more protection, and the glove is a lot less likely to tear. Never reuse a single-use glove. There's no way to adequately decontaminate if you're to do so without compromising that glove. So early in the presentation, we mentioned that there's no documented cases of being infected with a bloodborne pathogen while giving first aid. This might make you think that wearing PPE, especially the gloves, is not necessary. This couldn't be further from the truth. Always protect yourself. Okay. Be especially careful when handling broken glass, hypodermic needles, or towelettes, or towels containing any kind of contaminated fluid. Always use tongs and cardboard and a dustpan when cleaning up broken glass or hypodermic needles. Never use bare or gloved fingers, fingers when picking up these objects. If you're exposed to bodily fluids, evaluate the potential for inspection. Remember that there are 5 steps to infection, and unless your carrier's body fluids actually enter your body, there's no exposure. So if you believe that there's possible exposure, contact your supervisor and complete the forms designed especially for an exposure incident. Then contact your medical provider to discuss the next steps. If you've never had the HBV vaccinations, you might want to start the process, or your doctor might suggest that you receive a booster shot. Finally, following through with any recommendations your doctor will provide. Next step would be your doctor will provide medical forms outlining the steps to be taken, and you'll need to bring all of these medical forms back to your supervisor. So these medical records are kept by your agency and must be available upon request to the employee or his or her designated appointee. The records are confidential, and your agency must follow all HIPAA regulations to assure that they're kept confidential in a secure location. They cannot be released without an employee's written consent or required by the law, if required by the law. Finally, these records must be maintained for the length of time the exposed employee works for the company, plus 30 years. In summary, we've discussed the requirements that your agency develop an extensive risk exposure plan, and that this plan must be available upon request to all employees. We've looked at engineering controls, policies, procedures, personal protective equipment, and the Hepatitis B program. In the final step, we're going to watch a hands-on training video where we'll learn to take off the gloves without without contamination, using barbecue sauce, and how to clean up a blood spill.
How much blood does the what's it called, the powder stuff that's in our van that you dump on like blood cells? How much blood is that?
They're a single use. I'm not entirely sure. I mean, you wouldn't clean up a huge scene, but it should be enough to clean up whatever, if you have a rider that gets injured. It does clean up more than you would think, but that would be something worth considering.
Right. If there's enough that it can't handle it, you're not going to be the one cleaning it up.
No, yeah, you would be, it would be a larger scene where you wouldn't be responsible for.
I've never had one before, but I don't know how much it can handle.
Today I'm going to show you how to take off medical gloves or emergency gloves without contaminating your hand. Okay, you see I have these nice round gloves on my hand, all right? Now these are protecting me from the elements, the germs and whatnot. And I'm going to use this smoky barbecue sauce, great barbecue sauce, we'll use barbecue sauce and rub. It's actually really good barbecue sauce. If you don't mind me going off subject, I put it on like a lot of things to add flavor. Well, anyway, so we're going to show you how to put this, take off your gloves without contaminating your hands. So first I'm going to pour some barbecue sauce to represent the contamination, okay? So that's some of the barbecue sauce. You see that's on my hands, right? So I'm going to rub it around, all my hands are dirty, it's contaminated, they're contaminated. My gloves are contaminated. Let me put it over the side. So now comes time to taking them off, okay? To take off my contaminated gloves. So what I do is, first you go to the wrist, you don't touch your skin, you pinch at this part of the glove, right? You pinch that and you just pull it, right? You pull it like that. All right, so once you pull it, see this hand right here is not contaminated at all. So everything is on this. And then I am going to reach underneath right here with my two fingers. You see I got my two fingers inside right here. I fit two fingers inside right there, okay? And I'm just going to take it and pull the other glove with me inside and flip it on the inside out. So as you see, my hands did not touch any of the contaminated barbecue sauce. And I can just toss these gloves away. And my hands are totally clean. And now let's go wash them.
Whoops. Well, that was the end. That was the end of that video. So we've completed the session. Does anyone have any questions? We have some time at the end. I'll do my best to try to answer them. No? Okay. All right, then we'll end it a little early. So thank you.
Thank you.